I'm gonna be the first person here today. Works so hard, gets so much done. I love when I meet my co-residents, so I have some peace and quiet. Oh.
Hi guys, I'm Leah. I'm a PG1 resident here at Kadlec. I'm from Hermiston, Oregon, and I went to school out at Hillsboro, Oregon at Pacific.
Hi everyone, my name is Audra. I'm one of the PGY1 pharmacy residents. I'm originally from Dublin, Ohio, and then I went to school at Purdue University.
Hi guys, my name is Zach Miller. I'm originally from Des Moines, Washington, and I went to Washington State University. Go Cougs!
Hi guys, my name is Audrey. I am from Richland, Washington, and I went to school at WSU. Go Cougs! So my co-residents and I wanted to give you a little tour because we know that you may not be able to come see us in person this year, so we wanted to show you why we chose Kadlec.
Hi guys, welcome to the main pharmacy. So right to the right of me is our med carousel. This is where we house all of our medications. We have 2 of them. They rotate and we are able to pull all of our medications we need for the hospital. We also have refrigerators right over here that are also linked to that med carousel. So when we need to pull medications from the fridge, we can keep a nice accurate on-hand count so that we have medications when we need them. All right, welcome to the IV room. So we have our pre-mades and our pop-togethers back here. A lot of them have now been loaded up into the Pyxuses for ease of access for the nursing staff, and then also so that the patients get them quickly and on time. And then if you follow me back this way, we have our buffer room right here. This is our brand new IV room. We have our chemo side and our non-hazardous side. We also have all of our IV medications. If you can't find the medication you need here, you'll be able to find it over in the med carousel. We also have our refrigerators that house pre-made admixtures like potassium, vancomycins, things that we can grab really quickly for the patients and then send them up when they need them. Back here is where the IV pharmacist will sit. They watch the technicians as they're mixing medications right here, and then we have our nice little pass-through so that we can get medications in and out of the IV room really quickly. All right, and last on the tour is our admin offices. So our administration, so our pharmacy director, our operations manager, and our residency director, they both all have their offices back here. So CJ is our pharmacy director, Natalie is our operations manager, and Tim is our residency director and also our clinical manager.
Go ahead and introduce yourself.
Hi, I'm Anna Christopher, Pharmacy Infusion Services Manager here at Kadlec. I cover Kadlec Clinic Hematology Oncology and Kadlec Clinic Rheumatology, as well as the pharmacy medication assistants, concierge, and the consultant pharmacist for Kadlec that covers clinics.
So obviously you do a lot at Kadlec. What is it that kind of drew you to Kadlec, and what do you like most about Kadlec?
What drove me most to come here is really the mission and the commitment to the community. And so I find that it's easier to work and be passionate about your work when your company is passionate about the work as well, and is for furthering patient outcomes and making sure that the employees are taken care of, and they call us caregivers, and that the patients are taken care of as well. And so I think that all those marry together to provide the best possible patient outcomes.
Okay. And so you do the oncology rotation. So how about speak a little bit to what someone would expect going through your rotation?
Okay. Initially we started with our first class, an Oncology 1 rotation as an elective. I find that most pharmacists are terrified of chemo, and so I really wanted to provide this as an opportunity to kind of get pharmacists a little more comfortable with chemo, because I know that when they leave the residencies, when they graduate from their class, that when they're faced with oncology patients, they're not quite certain how to deal with them, and there's this just generalized fear of oncology, and the regimens and the treatments and the supportive meds. And so I really wanted to provide this opportunity for them to belay some of that fear, get a little more comfortable with the oncology process, to kind of understand the structure of it, and all the literature support that you can find, and just so that they can be advocates for oncology when they leave this rotation. And then we developed an oncology 2 just to further build upon that information. And so I think that was the first thing that really what brought this rotation about. And then what to expect in this rotation is to, by the end of it, you'll be expected to be working independently as an oncology pharmacist. I think that's where you get the most bang for your buck, is when you have to be the person that answers the question. You have to be the one that utilizes your resources to take care of that patient. And I mean, of course, there's always someone a phone call away, but in the moment, I really think that when the buck stops with you, you have to make that decision. You have to find that information, and you have to draw upon your knowledge. You have to draw upon your resources, and you have to make the best determination. And then you can validate it by asking a peer. But I think that's kind of the goal with this rotation, and the expectation.
Okay, thanks, Anna.
Thanks.
Hi, I'm Stephanie Proctor. I'm one of the critical care pharmacists here at Kadlec, and I'm a preceptor for the critical care 1 and critical care 2 rotations.
Hello everyone, I'm Ben Belinsky. I work mainly in the emergency department and precept for emergency medicine 1 and 2.
And I am Christina Aldridge. I'm also one of the emergency medicine pharmacists and precept along with Ben.
So what can we expect from your rotation?
In the emergency department, we are in a really great spot. We sit right next to the providers, so we're able to ask them, any questions that we may have and give them any recommendations. We work a lot with the nurses. We're super hands-on. We attend any code, procedural sedation, intubation, and we're just really, right there in the front lines, able to help out with anything that kind of comes in.
And the residents really transition from being more of an observer to really hands-on and independent by the end of our rotations. That's something we expect for them to just fully immerse themselves in the practice.
And for the ICU rotation, we have interdisciplinary rounds in our 20-bed ICU. So every day you'll round with physicians, medical residents, nurses, nursing students, social workers, respiratory therapists, pharmacy, and pharmacy residents. And I really love the interdisciplinary teamwork that we have up there. Everyone's expertise is highly valued, and we work really well as a team to help optimize our patient outcomes. So during your rotation, you'll make recommendations on rounds with the team. By the end of rotation, you'll get to round independently. We also do a lot of clinical pharmacokinetic consults, such as aminoglycosides, vancomycin, warfarin, and assist with those during the day.
So what do you guys like about the Tri-Cities?
What I like about the Tri-Cities, I'm originally from the Dakotas, so moving out here, it was a big change, but I love just how much there is to do. In the winter, there's almost 10 ski resorts within 2 to 3 hours. During the summer, there's so many hikes in the area. There might not be trees in the Tri-Cities, but there's over 300 days of sunshine, which is amazing. And there's the Columbia that goes right through the middle of town, so everybody's always in the river doing something. And it's not too far to find some trees, so there's different mountain ranges every which direction you go, but it's not super crowded, so it really is this kind of golden nugget of things to do that are pretty close, so it's cool.
Just like Ben, I'm originally from the Midwest, and so I also moved out here just to experience the Pacific Northwest, and I love the ability to get outside and do things. There's, like you said, hikes within town, but also some really cool hikes within a couple hours drive for some day trips. There's also the Columbia River, which I swim in all summer, and lots of running opportunities and biking trails around the area too. So I just love being outside and having the opportunity to travel and experience more of the outdoors.
Just like Ben and Christina, I'm also not from this side of the country. I'm from the Southeast initially, so moving out here was a really big change. But I love the Tri-Cities. There are so many outdoor opportunities. If you are into camping, backpacking, kayaking, hunting, hiking, there's something for everyone out here.
welcome to the most important stop on the tour, the cafeteria. Follow me. So in here we have breakfast, we have lunch and dinner. So for breakfast they always have burritos, sandwiches, eggs, pancakes, bagels, oatmeal, anything you want. For lunch and dinner we always have salads, sandwiches, soup. We have the grill options, so burgers, quesadillas, grilled cheese, things like that. And then every day we have alternating entrees. So we normally have a couple of different entrees. And then we also have desserts in here. We have chips, we have soft drinks, bottled beverages, pretty much anything you want. They've got fruit. And the best part about it is you can pay with your badge, which sometimes gets me in a lot of trouble, but it's also very convenient.
This is the deli. We're open 6 to 11. We make coffees, Red Bulls, and we have
So this is the Caregiver Cafe. So it's only for employees. It's really nice. You can come up here. They've got self-serve, so you can just do a self-checkout. So there's a ton of snacks, and then there's also refrigerated items like sandwiches, things like that, and then drinks as well. So it's a really nice place to kind of come, hang out, decompress a little bit during your shift. And there's a nice little fireplace, and then there's even a TV. Zach, what are you doing?
I'm on a break watching the game. Welcome to the 7th floor terrace. It's an outside balcony where patients can come outside to get some fresh air, but it's also a great place for employees to come and have lunch and just enjoy the view of Tri-Cities. Thank you for your interest in Kadlec's Pharmacy Residency program. We hope you enjoyed the quick tour of the hospital and information about some of the rotations Kadlec has to offer.